Hello everyone, my name is Anna Zelenyuk, and today I'm joined by Amy Jersild, who is a psychotherapist here at the Therapy Center of Philadelphia. Her expertise ranges from negative body image issues to anxiety and depression to eating disorders. And today specifically we're going to be talking about women's therapy. Hi Amy, how are you today?
Fine, thanks. How are you?
I'm doing good. Alright, so let's jump right in. How would you say a woman's negative body image reflects on her emotionally, physically, and mentally?
So I think physically, at the most extreme, a negative body image, if a woman's very preoccupied with her body image, can lead to an eating disorder. A number of other factors are probably likely to be present. It's probably not going to be just a negative body image. But the eating disorder might look like over-exercising or binging and purging, or weight loss through restriction, even abuse of laxatives or diuretics. In a more subclinical way, meaning a milder way, women with negative body images might be reluctant to engage in activities they would otherwise enjoy, like going to the gym, even just being out and about, even in hotter seasons, for example, when people are wearing fewer clothes. If there's a preoccupation with a certain part of their body that's going to be exposed, you'll see people's quality of life really get diminished during those times. In terms of emotionally and mentally, I would sort of globally call that psychologically, women can be preoccupied to the point that they're not really paying attention or devoting energy into healthier aspects of their life. So their energy, their creative energy, is going towards weight maintenance or preoccupation about the body image or the negative aspect of their body. And that energy might be otherwise directed to relationships or professional goals or educational goals or family or themselves. And again, it can also lead to depression, anxiety. Preoccupation itself can be thought of at its worst as an obsessive trait. So it has a pretty big impact on a woman's life.
Right. Now, when I was little, I always looked up to my mom, and whatever she was doing or how she felt about herself, I mean, it kind of translated over to me. I mean, she was always my role model, and she is my role model. So would you say there's a direct correlation of, if a mother has a negative body image of herself or a positive body image of herself, does that correlate directly to her children and how they feel about themselves when they grow up?
Mm-hmm. I would say it can have an impact and influence in both a positive and a negative direction. Again, a negative body image and eating disorders, and we'll just talk about body image, it's a pretty multifaceted experience. So if your mother, for example, struggles with her own body image, there's not necessarily a one-to-one correlation that you will too. There are lots of risk factors and buffers that people experience that can contribute to a healthy or unhealthy body image. We do know that people are more likely to have difficulty with their body image if they observe their mother criticizing herself, or more importantly, as importantly I should say, if the mother's husband or partner or other people in her life are critical of her body.
Right.
So if the mother's body is a target of physical abuse or verbal abuse by other caregivers in the family system, sometimes we see women try to really distance themselves from having the same body type as their mother, and you'll see them, not necessarily in a very conscious way, sometimes it is conscious, either gain a lot of weight or lose a lot of weight to try to distinguish their body from the body image or the body that they've observed as the target of aggression in a family system.
Okay.
But if kids and young women see their mother enjoy her body in many different ways, athletically, even just appreciating her health, but also the appearance of her body, that can really encourage girls and young women to develop a more positive body image. However, if the positive body image seems to be the sole source of a mother's self-esteem, so you can have a positive body image, but it's not necessarily healthy if it is the sole source of a person's self-esteem,
Right.
That can be problematic too, because it doesn't really model for the young woman or girl how to kind of ground their self-esteem on other aspects besides appearance. So it's really important for moms to try to refrain from critical fat talk about their own bodies or their children's bodies, and it's very important for people in the family system to not be critical of the mother or of the daughter, especially at different stages of development, including puberty. That's really the most sensitive part of development when it comes to body image.
Right, okay, yeah, that definitely makes sense. And as far as, I mean, aging, everybody's getting older, you know, with time. That's the process of life. But some women struggle with getting older, and they can't accept that fact. What kind of advice would you give to women that, you know, are looking at themselves and they're seeing changes, you know, maybe wrinkles here and there or other body changes? What would a therapy session look like as far as helping a woman accept the fact that she's getting older?
So I think really just taking it from the framework of a therapy session, I think you'd first want to look at the other positive relationships that the woman has in her life. Again, relationships that feed or diminish her self-esteem. Not just relationships with people, but relationships with creative outlets, her professional life, her children, whatever the case may be, even spirituality. And if there's the presence of other relationships, healthy relationships, that's already a lot to work with, because you know, you can try to help the woman enhance the connection with those positive aspects of her life, so that the body image, which might have taken a hit because of aging, feels less primary to her. You can also encourage a woman to make the distinction between having a perfect body versus a perfect or healthy relationship with her body. So a lot of people come at their body image or their feelings about their body based solely on how the body looks, how they experience how their body looks, or how other people respond to how their body looks. And especially as we get older, but this is certainly applicable to younger people as well, it's helpful to ask people to really think about what a perfect relationship with their body would look like. Is there forgiveness? Is there patience? Is there tolerance? Is there gratitude? Things like that. And then finally, there are plenty of things that can really help people, again, mitigate a negative body image, especially exercise, any form of athleticism or physical well-being like yoga, meditation, even walking, things that really help people appreciate not just the appearance of their body, but the strength of their body, the flexibility of their body, the pleasure of their body.
Right, and it's a good thing that you brought up exercise and, you know, eating healthy and all that. That's becoming a huge trend nowadays. I mean, a lot of people are getting into that, but would you say that plays a large role in having, you know, a better perception of your body and how you feel about yourself?
So exercise can be a mitigating factor in terms of negative body image, meaning it can really help people prevent problems with their body image, particularly if it's exercise that focuses on strength and flexibility, qualities that are separate from appearance. We do know that there are certainly some sports that require a very low weight or body mass index. Skating, dancing, gymnastics, and that can sometimes set people up for a problematic relationship with their body or with their food. We know that one of the buffers and one of the risk factors is either having, for example, a very encouraging coach in your life. Let's say you're a student, a female student athlete. If there is a coach that is really emphasizing strength and flexibility and the capability of the body and not the appearance, or if there is a coach that is really encouraging of a woman's relationship with her body and her athleticism, that can really help prevent negative body image problems. The counter, though, is if there is a coach that is modeling a particularly problematic relationship with food, eating, body image, exercise, that's a real risk factor. So exercise can go both ways. It can really help people manage a problematic relationship with their body. But like anything, if it's carried to an extreme, it can be a part of a problematic relationship with their body.
Right, right. And I mean, media nowadays, it's going crazy. You know, everyone's in social media, in, you know, traditional media as far as magazines and TV. And as time goes by, media has more and more of an effect on women, especially to look a certain way or dress a certain way. how do you think the media, or what ways do you think the media can act in towards just portraying, giving women that confidence to feel good about themselves internally, externally? What do you think the media can do to portray a better image for women and make them feel good about themselves?
Well, I think we're in an interesting time right now because so much media is actually driven by the general population, whether it's videos on YouTube or other blogs or websites, that lay people that aren't in the media officially can create. So I think there was recently a story about a girl who started a petition to get a plus-size Disney princess featured in a movie. And there are plenty of people who are have a large exposure to a large audience who aren't necessarily representative of this very thin, frankly, white beauty ideal. The media can help broaden that beauty ideal by showing people of different sizes, showing people of different races, even showing people of different gender orientations in terms of whether they present as primarily male, female, transgendered, whatever. I think the media in some ways has a responsibility. It's obviously not necessarily in their job description, but I think just by virtue of the power of the media, right. I'd like to think that they would feel they've got a responsibility to show a representative sample of what the female portion of humanity can look like. Acceptance.
Definitely, and I think just with blogs, like you said, and YouTube and everything, I think it's showing more of a normal, media nowadays, it's all focused on celebrity and everything, but YouTube really gives regular people an opportunity to, say something, whether it's about a certain topic or about, an image or being unique and being confident in your own skin. So I definitely agree with you in regards to that. And just so our viewers can know, what advice or tips would you give, the women that tune in every week to watch our webisodes? What would you say is a great way to maintain a positive image of themselves?
Okay. I think it's a really important question. And what I like to say to people who are struggling with their body image and wanting a better body image is that, a positive body image doesn't mean that you always feel great about your body. A positive, healthy body image means that you sort of travel along the spectrum. You've got good days and bad days, but you don't get stuck in one rut. You know that when you're having a bad body image day, whether it's because there's humidity and your hair is messed up, or whether it's because your pants don't fit the same way during a certain period of the month, knowing that that will end, and being able to tolerate that without reacting in a destructive behavioral way, whether it's restricting, over-exercising, binging, purging, that's a positive body image. Even if you have a fat day, a bad hair day, a bad body image day, a day where you feel more plain. What classifies a healthy body image is being able to move around that spectrum and having the confidence that wherever you are on the spectrum, it's temporary and it's fluid, and you can influence where you're at any given time. On that spectrum. So a positive relationship with your body needs to be permissive of ups and downs. We all have ups and downs in our emotional life. We have ups and downs in our relational life and our spiritual life. Right. Same for positive body image. Again, I would also encourage people to think about, what would be your ideal relationship? What qualities would that have? And even if you think about having a relationship in your life with a man or a woman, and then try to sort of think about how that would look in your relationship with your body image. Again, if you think about having a patient partner, having an accepting partner, having a loving partner, there are some days as well when you're simply not going to feel that great about your body, but if you can still reach out to people, not, for example, follow through on the impulse to isolate and not go out, that's strength, that's health. Being out and about and connecting with things that feel healthy despite having a bad body image day means that your relationship with your body is not the primary influencer of your overall well-being, and that's positive. Finally, I think surrounding yourself with other people who have healthy body images and who aren't necessarily engaged in fat shaming or fat talk towards themselves, being engaged in something athletic or something that feels really good physically in your body, trying to avoid things that really cause you to numb out or disconnect from your body, whether it's substance use or whether it's even vegging out in front of the TV for long periods of time as a way to escape from a feeling in your body or an emotional feeling. Really trying to stay present to your body can be helpful, trying to do that in a very mindful, conscientious way. It's a discipline, it's a practice, and it's not always going to go great, but again, health means the ability to kind of move in and out of different states of relationship with your body.
Right, and that makes a lot of sense. I mean, everything that you mentioned today, it's a process on both ends, mentally and physically. I feel like what I've learned just from speaking to you, it's, you shouldn't just focus on the whole physical aspect. It's a multiple variety of things, family, relationships, friends, and just, be able to discipline yourself, like you said, and get through the day and not feel like it's the end of the world because, today you can't fit in these jeans, but yesterday you could. So I think it's a great thing what you're doing, and I think women's therapy is very important. And I know you're changing lives day by day, so please give us some more information where we can find out about women's therapy.
So the Women's Therapy Center is, we used to be called the Women's Therapy Center. We are now the Therapy Center of Philadelphia. Would you like information about the Therapy Center of Philadelphia or about women's treatment in general?
Women's treatment, if you guys have a website, please tell us about that.
So if you Google either Women's Therapy or the Therapy Center of Philadelphia, you'll find us. There are also plenty of other organizations that focus on helping women achieve a better relationship with their body. You've got on the more clinical end Renfrew and Belmont that actually treat clinical levels of eating disorders. And then you've also got organizations online like the website Something Fishy and a few other websites that Something Fishy would link to. Something Fishy is a website that promotes, again, positive body image and positive relationship with eating and food. It's also a website where you can get information about treatment in your own area because it is a national website.
Okay, great. Thank you so much for joining us,
welcome,
Amy.
Anna.
And this was another episode of Health and Wellness.